Four, three, two.
Hey, folks, welcome back to another episode of Biz-Talk. My name is Rick Gutierrez. I'm your host and your business advocate. I'm excited to be here with you and for you guys to be joining us here today. We're going to have a great show. We've got a great lineup of business professionals that are going to be showcasing all of their expertise and their journeys in business as well. We are excited because this week we've got a very highly educated expert in his field who's going to be educating us a little bit in the world of healthcare. And that is Mr. Yassir Sonbol, who is joining us today. And he is full of knowledge and can't wait to hear how he's going to educate us, in this market. So, Yassir, welcome to the show. We appreciate you being here. I know that you're always a very busy man. You must have your calendar very busy, but we're excited that you're here and we want to welcome you to the show.
Thank you for having me.
Absolutely. We always have a great time on the show because we have, subject matter experts. Everybody's an expert in their own field and they've been in business for a little while. But we also do like to ask questions within their field to showcase their expertise, but also, maybe shed a little light into just business in general, how you got here, and all of those great things. So, what do you say we get started?
Absolutely.
Fantastic. So, we know that you are a medical professional. You are a doctor. And, first and foremost, we want to let our audience know who Yassir is and how our audience can get in touch with you. Perhaps you have a phone number or a website that they can check out just to get a little bit more information. So let's introduce you first and then we'll get started on the topic.
Sure. My name is Yassir Sonbol. I'm an interventional cardiologist. I'm actually from Minnesota. Moved here back in 2011 to start. Came here for worked for the Oakland Medical Group for a little while, and then went into private practice and been on my own ever since 2013. Did all my training in Minnesota as far as cardiology and interventional cardiology, and then came out here just kind of I was working in a small town and wanted to get to a bigger city, and so ended up in Houston. We have our practices in Sugar Land. It's been in Sugar Land for the last 12 to 13 years now. And we really liked being out here in Fort Bend County and enjoyed it. So, our office is attached to Methodist Sugar Land currently at this time. You can call my office through our numbers on our website, which is sugarlandcardiologyspecialist.com. We're also on social media, Facebook, and we have a YouTube channel as well.
Absolutely. All right. Well, thank you so much. We appreciate it. We see that website scrolling through there. And you guys being in the Fort Bend, Sugar Land area for about 10 years, are you guys focused just on the Sugar Land area or you service all of Houston and surrounding areas?
My focus has really been in Sugar Land only. So I kind of Sugar Land, Richmond, Rosenberg, in that area. I used to go out to Bay City and Wharton a little bit, but I stopped doing that. I just didn't have the ability to get out there as much as I'd like to.
Okay.
But my focus has mostly been in this area, yes.
Okay. Perfect. We just wanted to ask that question because maybe there's somebody in the outskirts of Houston and whatnot, and they want to get in touch with you. They've already got the website and all those good things. So, and we'll be sharing a little bit more throughout the course of this interview here. All right, so let's get into healthcare and your expertise here, Yassir. The cost of healthcare obviously is something that just seems to be like on the uprise almost every year, almost every 6 months. Obviously, there's health insurance that gets involved and whatnot. But let's talk about cardiac care. And why is so expensive? Why is it that is it becomes sometimes a situation where a lot of people may not go through with what they need just because of the cost, right? But I do know personally that there is a lot that goes into cardiac care. And so enlighten us a little bit as to what all it takes and the cost that it takes for to do what you do.
Sure. So, I mean, I think a lot of the cost of healthcare obviously is related to equipment, devices, medicines, et cetera, right? And so that's outside of, physician physicians per se. So when you look at, for example, if you get a bill from a hospital, right, the bill is actually a lot of information that most of it is related to hospital costs, medicine costs, equipment costs. Your physician cost is probably the cheapest part of the entire hospital bill, to be honest. And the reason healthcare is so expensive, I mean, there's a lot of reasons, but part of it is when you look at, for example, medicines. Medicines are designed by pharmaceutical companies, right? And so those pharmaceutical companies have to go through this extensive research process in order to be able to give patients these medicines. I mean, there's 3 phases just of a drug trial before the drug is actually allowed to be given to people, on a routine basis by and prescribed to patients, right? And so the FDA approves it and all that. So when medicines first come out, they're what we call, obviously not generic, right? At that point, so they're designed to a specific company. That company is the one that kind of sells the drug, and really the costs are set by the company and between them and insurance companies and pharmacies, right? So and so those costs are not set by physicians per se. But those pharmaceutical companies, unfortunately, they want to make their investment back on what they did to research this drug. And so that's why, first of all, medicines are expensive when they first come out. Now, there's a period of time where you're looking at about 7 years where a drug is labeled, not generic until it can become generic, which means any company can start making this drug after a certain number of years and it's become cheaper. But actually, what ends up happening is pharmacies actually can regulate the price of that drug as well. So even if a drug is generic, a pharmacy may decide, like Walgreens may decide to say, well, I'm going to sell this drug for $50 for pills, right? And the same goes for devices, right? I mean, these companies go through all this research and testing to see whether their device is safe to use on people exactly. And so they set the cost of it, and so that's what makes the cost of healthcare expensive.
Right.
In cardiology, there's a lot of advancements all the time. I mean, it's a very, very growing and advancing field on a regular basis, whether it's in medical, health, I mean, like prescriptions and medicines, whether it's in devices and technology. I mean, just think of the things that recently came out. If there was a recent article out about Baylor, implanting this artificial heart in people, right? And this artificial heart is this pump that's designed for people with heart failure that maybe gives them an extra 12 years that allows them to live on it until they can get a transplant. I mean, that's probably not a very cheap device to make and test and make sure it's okay and safe for humans. And so, it's just the way. I mean, medicine, in the end of the day, as humanitarian as medicine is a business, right?
Mhm.
In this country, and it's a business run by hospitals, pharmaceutical companies, device companies, etc. And so that's just the nature of the business, unfortunately.
Yep, absolutely. Now, a minute ago, I heard you say something about, the pharmaceutical companies can also, all of that cost just basically adds up. But it's those third party companies. I mean, you as a health provider, you could potentially regulate and or have control as to what the cost would be on your end. But when you have to get third party companies involved, then that's when we lose a little bit of control. And it's just we have to kind of go with what third party companies are charging and whatnot. So yeah, is there anything that either patients or healthcare providers, working together collaboratively to make those treatments more affordable?
Sure. I mean, so for example, let's just take a common drug that people use nowadays, like Eliquis, right? It's a blood thinner. It's used for people with, let's say, atrial fibrillation, which is a common abnormal heart rhythm that we see to prevent strokes. It's used for, people that have blood clots, etc. It's not a cheap medicine, right? And it's not generic. And so a lot of times I get pharmaceutical reps that give me samples of that medicine in my office. And so when I have patients, for example, that are on it, the best way I can help them is, offer them samples to the drug to at least alleviate some of the cost of the medicine from them, right?
Mhm.
A lot of these companies as well have programs that for patients, for example, that let's say financially they can't afford it, but they need the drug. Now that's through the pharmaceutical company itself, where they will go through their finances and see if they're eligible. and actually offer them the drug at a lower cost or a lower rate, or even sometimes free. But those are not things that I can do, but I have the resources
Mhm.
that allows them to look into that, for example.
Right. Okay. Well, it's good info. I mean, every little piece of advice, every little piece of information helps, not only the healthcare provider like yourself, but also the incoming patient so that they can, better prepare so that, it could be a little easier to bear with. Um, Let me
There's
ask you
also,
now.
a lot of medicines
Right.
have a generic alternative, right? So, I mean, it's
Right.
also incumbent upon us as healthcare providers to say, would a generic alternative do the same job? And is it almost as effective? Because when you look at the data for a lot of these medicines, a lot of it's pretty close, right? You're talking about small percentage points in variation. And so if a generic medicine will give the same benefit that a non-generic medicine would, then a lot of times I just, as a provider, will prescribe the generic medicine to make it simpler on my patients.
Right. Yeah. No, it makes total sense. Yeah, sir, we've got about a minute and a half left on this segment here, and I think it's crucial for our viewers that could potentially be coming up with some heart-related medical expenses. What advice do you have for families that are trying to plan for such event?
Obviously, getting insurance is important. I mean, I think it's an undervalued thing. People think, nothing's going to happen to me, but that's the whole reason we buy insurance, whether it's on our car, our house, and even our health, right?
Right.
A lot of times it's looking into alternatives. For example, you can call different hospitals, different providers, etc., and figure out, what the cost of something may be if you don't have insurance and what kind of payment options are available, things like that. There are health savings accounts that people can create. I mean, there's a lot of other possibilities that you can look into, but when it comes to heart conditions, I mean, I don't think nobody ever really plans on having a heart condition. So a lot of times these come as a surprise. And so, there's really no good planning for this financially unless it's something, that you are planning to do it for a different reason. But I'm not aware of it in the heart world where you plan for something like this.
Right. I mean, there could potentially be a situation where one knows, that there might be a surgery coming up and whatnot.
Hmm.
But sometimes, most parts, something like this, there's no warning.
Right.
It just happens and you have to have it. And it is what it is type of situation.
Right.
All right. Yazir, I want to thank you so much for being on the show. Your knowledge is invaluable to all of us. It's something that we definitely need to know about and be aware of all of this. So I want to thank you for being on the show. And hopefully we'll see you again in many other episodes here on Biz-Talk.
Thank you for having me. I appreciate it.
All right. Thank you. All right, folks, we're going to take a quick commercial break and we'll be right back with another subject matter expert. Stay right there.